Colorectal cancer is the second leading cause of cancer-related deaths in the United States, yet it is one of the most preventable and treatable forms of cancer, that is when caught early. Here to spread some awareness about what you need to do in order to do that, Dr. Kevin Stevens Sr. Good to see you, good sir.
Good morning, how are you?
Doing all right,
Great,
doing all right.
great.
You know, what's interesting about this is that it is treatable, but we're seeing cases earlier and earlier among people.
Yeah, it's probably has something to do with diet. I mean, you should limit the red meats and processed food like stuff with salt and those kind of things, because we know that increases your risk of cancer. And remember, we don't know what really causes it, but we know what you can increase your risk.
Sure thing. And so with that, the colonoscopy is important. What's the age for that?
Well, if you're 45 or greater, you should get your colonoscopy. Now, the other thing, what happens is that you get what we call polyps in your colon. And then the good thing about colonoscopy is that you can go and look and find the polyp, and you can remove it and reduce your chance of colon cancer. And the cancer that is more problematic in the colon, for the colon is like 4 or 5 feet long, is on the proximal side, which is right next to the appendix. So you have your small intestines, they go right to the colon, and then the appendix is at the end of the small intestines right there. And that's the hard part to get. But you know what? Eating yogurt and stuff may reduce your risk.
And is that because of the probiotics in them? Or?
Exactly,
okay.
Exactly.
So just talk to me a bit more about that.
Yeah, well, they had a study that just came out not so long ago that said that people who ate 2 servings a week or something of yogurt, they had a reduction apparently in the polyps that could lead to colon cancer. It's still early, we don't know. But you know, the other thing is fiber is good also, and oatmeal and those kind of things is good.
And we're looking at some of these statistics now on the screen, some 107,000 new cases of colon cancer, and you're looking at the breakdown among gender, also 46,900 new cases of rectal cancer. Those numbers are higher in men than women. Why is that?
Probably because of diet. Men tend to eat more on the go when you're working in the daytime, and the women tend to eat more salads. You know, they're more concerned about their weight than most of us. So they tend to pick healthier, higher fiber diets as opposed to eat meat, you know, red meats and that kind of.
And as you said, we
and
don't
alcohol.
That part too. Got a segment coming up about that later. Stop it. Lent is next week. You tell people to stop after Wednesday. Come on.
Yeah, that's right. You have to. It's all right. All right. Just hold that thought.
Right. Next Wednesday we care about that stuff. But no, all seriousness here. You say that diet is a way to prevent the risk of cancer. Anything else as far as preventable options are concerned?
Well, get the screen. That's the main thing. Yeah. A lot.
And you say 45, but I mean, with it happening younger, I mean, should you go when you're a little younger just to be safe?
No, it's not. If you look at the prevalence of it, people less than 45 is really, really small. But we are increasing the risk and the prevalence of it from 45 to like 55. And then, of course, over 55. But the key thing here is that they have 2 ways you can do it. One is a colonoscopy, where they actually take a light and they go and look at your colon. The problem is a clean out. I mean, but Cologuard and agents that they can use, you can do it in your home, and you mail off the sample, and if they see blood or something like that, they'll let you know. So it's quite easy, quite quick, and it's very much can prevent problems later on.
All right, sir. In that case, I guess no need to drink a gallon of magnesium citrate. Always a honor to see you here. You know, we talked about the screening process.
What do you know about that?
I've seen. I've never had to, but I've seen, and I've heard the complaints. As a matter of fact, listen, y'all, there are several tests that can screen you for colon cancer. Some of them you can do at home. Most people should begin screening for colorectal cancer, as we mentioned, soon after turning 45 here.